Okay, to finish up with the lower extremity, we're going to finish with the foot. The foot begins at the ankle joint where the talus, one of the first tarsal bones, articulates with the tibia, as well as the fibula down here. So when we look at the foot, there are three groups of bones. There are 7 bones that are most proximal, called the tarsal bones. Then we have metatarsal bones. There are 5 of them from digit 1 on the big toe over to digit 5, the little toe. And then we have the third group of bones called the phalanges that make up the digits or the toes. So let's start with the carpals to begin with. Marked in black here is our talus bone right in through here that articulates with the tibia and the fibula to make the ankle joint. That's also why we call it the talocrural joint, because talo for talus, crural for lower leg, tibia, and fibula. And if we turn this foot on the lateral side on this right foot, we have this big bone right back here marked in red, which is our heel bone. This is called our calcaneus. If we flip the calcaneus or the foot upside down, you can see the calcaneus comes around this way and has this branch of bone that's the talus sets on, we can see here. This is called the sustentaculum tali. Then when we flip the foot over, we look at the remainder of our 5 tarsals. The one marked in green is the navicular, distal to the talus. Then distal to the navicular, we have 3 blocked bones called the first or medial cuneiform, the second or middle cuneiform, which is marked in blue, and then the third or lateral cuneiform right here. Then over to the lateral side that's distal to the calcaneus, we have the cuboid bone. And then if we look at the first, second, and third cuneiforms, as well as the cuboid bone, all 5 metatarsal bones articulate to the 3 cuneiforms and the cuboid. We see that the first or medial cuneiform gives rise to the first metatarsal, or digit 1. Middle or second cuneiform gives rise to the second metatarsal and second digit. Third cuneiform or lateral cuneiform, then we see the third metatarsal and third digit comes off of that. And then we see 4th and 5th metatarsals and digits come off of the cuboid bone. Now, on the metatarsals, it's just simply when we start at digit 1, which is the big toe, it's just metatarsal 1, metatarsal 2, metatarsal 3, metatarsal 4, metatarsal 5. Metatarsal 5 is at the beginning of the little toe. Other structure to note on the metatarsals is on metatarsal 5. On the lateral proximal side, marked in orange here, is the tuberosity of the 5th metatarsal. That's a very important landmark that'll come back when we talk about muscles and their attachment at the foot. Then if we go on distal to the metatarsals, we're going to find that all 5 digits have a proximal phalanx, so proximal phalanx of digit 1, digit 2, digit 3, digit 4, and digit 5. Now, digits 2 through 5 have a middle phalanx, which is right here, and then digits 1 through 5 have a distal phalanx of digit 1, 2, 3, 4, and 5. Now, when we look at that, we have some interphalangeal joints in joints where the phalanges meet the metatarsals. So all 5 digits have a metatarsal phalangeal joint between the metatarsal and the proximal phalanx. Then we have what's called, on digit 1, between proximal and distal phalanx, we have an interphalangeal joint, which is right here. And then on digits 2 through 5, we have interphalangeal joints between the proximal and middle phalanx, called the proximal interphalangeal joint, or PIP, which is right here. Then we have a distal interphalangeal joint that's between the middle and distal phalanx, that's between the middle and distal phalanges here. So this would be the distal interphalangeal joint right here, which is also referred to as the dip.